1, 2.
One, two, one, two. Fine. One, two. But better, but I have to stand a bit close. Still soft. One, two, one, very soft. Yes, I am in the max. From its max. No, there's nothing. No, there's nothing. That's like a blank. Sounds a bit better. A bit scratchy. Testing one, two. One, two, three. Very soft. I have to speak close into the mic basically. Yeah. Paul. Testing 1, 2. That's honest, Max. Still a bit soft. That's better, but I have to speak into the mic. How does that sound? It's still a bit soft, man. 1, 2. Testing 1, 2. Paul, if I speak a bit louder, then it helps.
One, two. Testing 1, 2. 1, 2, 1, 2. Testing 1, 2. 1, 2. Testing 1, 2. Testing 1, 2. 1, 2. Testing 1, 2.
1, 2.
1, 2. 1, 2. Testing 1, 2. 1, 2.
Testing 1, 2. 1, 2.
1, 2, 1, 2. 1, 2, 1, 2, 1, 2. Testing 1, 2. 1, 2. Testing 1, 2. 1, 2, 1, 2. Marlon, it's better. 1, 2. Testing 1, 2.
Oh, that sounds much better. One, two. That sounds much better. It's still a bit soft. Still a bit soft, but yeah. Can we just test this?
1, 2. 1, 2. Okay, good afternoon, everybody. Hello. Good afternoon. Okay, good afternoon, everybody. Good afternoon. So you all sound tired. I'm going to avoid saying you all sound hungry, because I may be put in a difficult situation of arranging lunch for you. And that's a complex task, because it costs so much. But hopefully they arrange lunch for you, right? No? So just to let you know, I'm not the organizer. You can take it up with the organizers. And I'll show you who they are a little later. Unfortunately, they all report to me, so the buck stops with me. It puts me in a difficult situation. Okay. Well, good afternoon. I hope you're well. Are you good? You are? You are? Some of you are not so sure. I hope it's not the lunch issue. But anyway, thank you for coming. Who's busy with exams at the moment? I know you're writing. Anybody? Can you give everybody a hand who's busy with exams and made time to be here? So they could have been studying, right? But I suppose tonight they're gonna burn the midnight oil, nah? So we wish you well. Come back with your results. Just by virtue of being here, trust me, you're going to get an A+. Yeah? If I was in a church, I would say I prophesy it. But I won't, because I'm not. Okay, great. So we're going to get started, and I'm hoping that everybody has... It's going to be a long afternoon. 3-4 hours at least you'll be here. I'm kidding. We'll try and get the show done, or this work done in the next hour and a half at most, right? Or 2 at the most. Hopefully an hour and a half. So let's see how we go. Hint, hint to all the speakers, by the way. So hopefully we'll get moving. I need a sense of... can you hear me? Is this audible enough? Is it loud enough? Or maybe because I'm here, right? Okay. So Lesejo, I don't see you anywhere, and I'm trying to figure out where is Lesejo and the rest of the team so we can get started. Caesar, I don't see Caesar either. Oh, she's here. Okay, it is 14:03, which means we are 3 minutes behind schedule. Yeah, we're supposed to have started at 2. Oh, they told you one? You know why they told you one? African time. Yeah, that's why. They know that when they say 12 o'clock, you'll only get here at 1. So they didn't tell you that we're actually starting at 2, but they wanted you here at 1, just to check. Okay, so we're going to get started, and I have to get started because of time. I want you to stand, if you could stand on your feet, everybody. I know this is a school, right? So, yeah. Okay, great stuff. So, for those of you who don't know, my name is Linton. My surname is Mkunu. I'll be facilitating your program today. I may just do half of it because they don't pay me enough to do the full show. But we'll see how it goes. And I'm the Acting Director General at the Department of Social Development. Isn't it good to have young people in these positions? That's the point you're supposed to clap, because the problem is I said that and my boss is not here. So remind me to repeat it when she comes in, right? I'm lobbying for those of you who don't know. I'd like you to go to 3 people and just greet them and say, it's good afternoon, it's nice to have you here, it's good to see you, I don't know you, this is who I am, this is what I do. Just for 3 minutes. One, two. There are some of you who have not moved from your seats. You haven't moved. You did? Are you sure? Okay. Sorry. So let's do this. All right. Okay, let's do this. Right. Let's do this. Okay, I take it you've met 3 people. Hello? Right. So I take it you've met 3 people. Hopefully it's 3 people you didn't know before you got here. So because we're in a school, I'm gonna ask 2 or 3 of you, because we're in a school and we're in a learning institution, let's see how well you remember things. So I'll ask you who are the 3 people you met and what they said about being here. Is that fine? My sister with the glasses. Yes, you. So the more you look at me, the more I'm attracted to look at you. Can we have another mic? Do you have another mic? Do you have another roving mic? Do you have another mic? Do we have another mic? Hello? You know, okay. Can we have another mic? Another mic. I want to give it to my sister. Okay, so she's going to tell you who are the 3 people she met and what they said about being here, right? Your name, what you do, where you're from, and then talk to us. I like what's written on your top, by the way. First things first, improving well-being, inspiring success. Can we all listen? Can we all listen to her?
Hi, my name is Zintle. I'm from UWC, from the HIV and AIDS unit program, and yeah, it's lovely being here. And the girl next to me said she's very happy to be here. Her name is Kanyisile. We didn't get to that part.
Thank you very much, Kanyisile. I'd like you to put your hands together as our Minister of Social Development walks in. You're welcome, Minister. Now, Minister, I must tell you, you are in the presence of young people. Are there any young people in the house? Now, let me tell you what's the definition of young people. Can I tell you? If you are under the age of 35, you're considered young. So just turn to the person next to you and say, you don't look 35. I'm kidding. Okay. I'm kidding. All right. Okay, let's get to work. Okay, let's get to work. Right. I'm attracted to people with glasses. My brother.
Hi to everyone. It's on. Okay. Hi to everyone. My name is Mpo. I'm from here at UCT, engineering, chemical engineering student. I met three brothers. Yeah. So one is Sonobile, who works at Sasa. I met Yanga from Nyanga, and I forget the brother's name. But he's also from Nyanga, right? Yes. So I met three. Yeah.
Worried why you're only meeting brothers and not sisters. Anyway. Welcome. Just give the person next to you a high five and say, I'm glad I'm sitting next to you. Okay. Right. Okay. So welcome to this important program. Thank you for making time to be here, especially the students. Don't forget to claim your A+ after this. Welcome to everybody. Really, thank you very much for being here. I know you're busy, your schedules are hectic, etc. But I didn't say sit down. I'm not sure why you're sitting. This is the problem with students, you see. Please remain standing. Please remain standing. Please remain standing. Please remain standing. Okay, everybody remain standing. Not only the under 35s. Okay, if you're not able to stand, it's okay. We understand. So we're gonna have some fun today, and hopefully we'll have some level of interaction with you. Get a sense of a number of things. So, for example, I want to get a sense from some of the people in the room if they have any idea which is the most used drug in the country. I'm not gonna. We'll get to that a little later. And then I'm also very interested in what the brothers and sisters are drinking. Not to say that I've got something arranged for you after this. No. Just to get a sense of what are we drinking. What do you drink? You know, what's the most drunk or drank? Drink and taken. Thank God I'm in a school. Alcohol. Okay. I'm not going to say anything. I won't say anything. But let's do this and let's do it right. Let's get started. I'd like you and the sound guys at this point in time, we're gonna get started, and I'd like you to stand. We're gonna sing the national anthem, and I hope you know it. So let's get started. Thank you very much. Great stuff. You may be seated. Well, thanks once again for being here this afternoon. Thanks once again for being here this afternoon. Where I come from, they call this the graveyard shift. Because you've just had a big lunch and then you're expected to focus in the session after lunch. But, I'm with young people here, so I know that we've got energies. And nobody's going to fall asleep. If you catch you falling asleep, we've got the professor here who will deal with you. But thank you very much. Okay, so, I want to acknowledge everybody who's in the room this afternoon rather. Starting with the minister, can you give her a hand? See, she looks young. She looks very young. I almost said something that's gonna. No, okay, I won't. Thank you, Minister. I won't. I'd like to also acknowledge the representatives from the university. I think we've got Prof. Goodman Sibeko, Prof. Dyer Reddy. We've got Prof. Lionel Green, Thompson. Right. So I'd like to acknowledge everybody, including our colleagues from the Departments of Correctional Services, the Department of Health, Higher Health, and every other institution that is here, including the National Development Agency, SASA, and everybody, NGOs. I understand you may be here in the room. And of course, give it up for our DSD staff. So I'm going to show you how we roll at DSD. So this is how we roll all the stuff. Guys, can you stand? Show them how good you look in your attire. Come on. Stand. Don't they look proper? Yeah? Come on, stand, guys. So here's, thank you very much. Sit down, thank you. So here's the interesting thing. What they're wearing, guess what? Designed and made in Mzansi by young people, young entrepreneurs who are making things happen. So if you want one of these, come talk to me. We'll talk about management fees, middleman kind of a thing a little later. But anyway, thank you very much to the colleagues. You look good. So we're not going to waste a lot of time this afternoon. We're going to get straight into it. And I'm going to welcome Prof. Dyer Reddy to come, and the VC, your Vice Chancellor, to come and quickly give you welcome remarks. Can you put your hands together for the Prof?
So, Honorable Minister, Lindiwezu, senior officials, colleagues from the Departments of Social Development, Correctional Services, Higher Education and Training, and Science and Innovation, CEO and senior colleagues from Higher Health, from Grootegeluk Hospital, our Dean of the Faculty of Health Sciences here at UCT, UCT colleagues, and students, all protocols observed. Good afternoon from me, everybody. So it's really a great pleasure for me to be here to welcome you to a very special event. It's special in many ways. Firstly, in the fact that we are marking the outcome of a collaborative effort between UCT, the Department of Social Development, Higher Health. So the collaboration is really the one important aspect of it. And furthermore, we are going to be launching two initiatives, dual initiatives. The DSD Integrated Program for Gender-Based Violence, Anti-Substance Abuse and Social Crime Prevention, and the Web App Assist tool. So, you know, we're a university, and we teach. That's part of our core responsibilities, and we do research. And as researchers, we have responsibilities that go beyond the original work that we undertake. And that is to communicate our results, the results of our research, to make these results accessible, and very importantly, to develop the means by which the knowledge that we generate in this way can improve the quality of life for the people and the communities around us. That's very important. So the context of much of what we do here at UCT, that is our teaching, our research, our social responsiveness as well, is provided by UCT's strategic plan for a sustainable future, and it goes by the name of Vision 2030. And Vision 2030 redefines our commitment to unleash potential, to create a fair and a just society. So that underpins everything that we do, including what we are here to mark and to celebrate today. According to statistics provided by the online rehab website, and you'll find this in many, many other places, drug abuse costs South Africa as much as 20 billion rand a year and affects some 15%, 15% of our population. This translates into a whole myriad of problems such as drug abuse, rising crime, harmful effects on family life, on social life generally, on the ability to learn, productivity at work, and general health and well-being. So the Department of Social Development embarked on the process of coordinating and providing integrated early intervention and preventive measures to curb social ills among children and youth in institutions of higher learning, such as ours. And through these engagements, more than 300 campuses, these are at our different universities, well, we've got 26 universities, but we have TVET colleges, we have private universities, and other institutions of higher learning. All of these have been able to be reached in a really laudable initiative. The web app version of ASSIST, so ASSIST, the acronym stands for Alcohol, Smoking and Substance Involvement Screening Test. ASSIST is a tool that's been developed by the International Technology Transfer Center here at UCT with support from the World Health Organization. Its real asset is its simplicity. It can be administered by a professional as part of an interview with a patient. Excuse me. As part of an interview with a patient. Or it can be self-administered electronically. So very simple, very easy to use. And it obviates the need for paperwork. So there's an enormous amount of data that is collected in this way, anonymously, I should say. What does one do with it? What can one do with it? Well, we can provide counselors, medical practitioners, and policymakers, importantly, with a live, passive substance abuse risk map. So a risk map will give you an idea of what is the nature of the risk, how is it distributed across the country in various regions, age groups, and so on. In other words, you've got a living database, and that is exactly the sort of thing we need. Medical practitioners, the medical colleagues, as well as policymakers, such as our colleagues in the Department of Social Development and other departments, who are able to use a meaningful and a data-rich overview of how this menace is affecting our country, and having done so, can then enable appropriate policies and interventions to be developed and to be implemented. So really, really important. On behalf of UCT, I very much want to express our appreciation for the involvement of the Ministry, the Minister and the Ministry of Justice and Correctional Services, the Ministry of Social Development, of Health, and of Higher Education and Training in the development and the testing of the Assist app. So, as you can imagine, one really has to test very, very thoroughly before it can be let loose. So thank you. The involvement of so many ministries, I think, will give us a good idea. It emphasizes the wide reach of substance abuse in South Africa and the need for a comprehensive response to fight it, and the clear commitment that we have from across so many of our ministries, right? It's not only for social development a concern. Assist, the app, serves the full spectrum of society, from the individual to the non-specialist healthcare or social worker, all the way to the top levels of government, where policy decisions are made. Policies are developed and decisions are made. So in this way, it offers an excellent example of how research and scholarship, coming back to what it is that we do at a university, research and scholarship, in this case, drawing on modern technology in our digital age, how that can unleash our potential to create a fair and just and a healthy society. Thank you very much.
Thank you, VC. Thank you, VC. Let's appreciate VC one more time. And I think what I like, thank you for welcoming us, VC. I feel more at home now. More welcome, thanks. What I appreciate about that is really the use of technology and innovation, as you highlighted, Prof, in addressing some of the challenges that we face today, largely substance abuse and alcohol abuse. So when we talk about substance abuse, most times people only think about the drugs part, right? But it's not just the drugs part. It's also the alcohol part. There's research that has come out. In fact, this morning we had a very interesting meeting with DGMT, and the research really talks to a number of very important aspects. But what I think shocked me more than anything else is that, firstly, South Africa does not have a challenge with drinking per se. The problem that we have in South Africa is binge drinking. Anybody know what's binge drinking? So when we see a court, we don't see one court, we see one court plus another 6. So when we see the bottle of Jameson and you're sitting alone, don't be shocked how I know these things. And you're sitting with the bottle of Jameson and you don't see the bottle and think, one shot today, one shot tomorrow. We are finishing this bottle today, right? And so that's the problem that we have in South Africa around binge drinking. And that's a serious challenge. We are told that also there are serious harms that come with binge drinking. 1 in every 10 people that die in South Africa die because of drinking of alcohol. We are the highest binge drinking nation in the world. What a terrible stat to be known by. Quite embarrassing if you ask me. And really, really is a concern. And the shocking thing about it, Prof, is that, you know, I come from a community or a society where, you know, when they have birthday parties, and when we party, you know what I'm saying? We party. It can even, Minister, be a birthday party of a 1-year-old. We are full there, and it's going on, which is a problem. The truth of what does a 1-year-old child know about alcohol? Why are you drinking on behalf of the child? You understand? So it's a serious problem, this thing of binge drinking. And then the other problem we obviously have, Minister, when we're at home and we know there are children in the house, umalume wants to send the child to go and buy alcohol at the shop. Why, Bafwetu? Why? The problem is we leave umalume because we're scared of him. And umkhulu sometimes. We can't allow that. It's wrong. We shouldn't. No, even ubaba sometimes. No, mama. It's true. I'm trying to protect you ladies, Mario Abon. So, but it's the truth. It's the truth. And so we're gonna address this thing. We're gonna talk about, can you imagine if you're one, okay, let's put it this way. Your child, your sister, your brother, when they are one, they have a party, ziyabuya. And everybody, imagine your uncle sending your daughter or your son to go and buy alcohol. Obviously, is going to grow up thinking, I'm buying it for Malum. Let me taste, man. And sometimes they will say, come try, come try, come try. You know, so it's a problem. We need to address that issue. Anybody agree with me? Yes. Yeah? 100%. So, before I call on the next speaker, let me just say two things quickly, maybe three. Firstly, so alcohol and drug abuse is a really complex matter, and really intersects between the public health, safety and social issues in the main. It takes a heavy toll on families, on communities, including students, by the way. Sometimes they say you cause problems not only in the school but also at home because of alcohol. So including institutions, students at institutions of higher learning. Whilst it has been argued that there is some level of correlation between social economic factors, including poverty, inequality and unemployment as a key contributing elements to the increased use of drugs or alcohol, and the development of substance use disorders. Substance abuse and alcohol abuse is certainly no respecter of persons. Whether you are black or white, whether you are green or whatever, whether you are young or old, whether you are rich or poor, irrespective of whether you are fat or thin, it doesn't matter. It's no respecter of persons. Once you're hooked, you're hooked. You know? So don't think it's never happened to me. It's not going to happen to me. Be careful. So whilst, so let me just say two things. I'm on 3 now, sorry. All right, so I'm sure everybody in this room knows somebody, a family member, a friend, a cousin, etc., who is addicted to drugs and addicted to alcohol. So don't think it's not going to come for you or your surroundings. It's everywhere. It's everywhere. So we need to be very careful and cautious around how we handle this thing. So today we are doing two things, ladies and gentlemen. Very importantly, we're going to launch 2 projects. One, in fact, we're going to get research results from the one project, which is the Assist app that the Prof has spoken about, the alcohol, smoking, and substance involvement tool to curb social ills amongst youth in institutions of higher learning, and some pilots were done at higher learning institutions as well as correctional services. And then, of course, we're also launching our integration and prevention programs, and I think that that's also important. We've reached thousands of students across the country since we started this work, and we are launching the new iteration today. So after you are lucky you're the first for the year, I think, for the year, right? So after this, every university, every technical college, etc., will be exposed to the kind of program that we'll be talking to later today. So turn to the person next to you and say, I'm privileged to be the first. Wonderful. Now, let's go to, I'm going to call on the UCT Division of Addiction Psychiatric Head and ITTC South Africa Director, Professor Goodman Sibego. Can you put your hands together for him?
Honorable Minister Linda Zulu, UCT Vice Chancellor Professor Daya Reddy, Department of Correctional Services Chief Deputy Commissioner Ms. Naana Molepe, CEO of Higher Health Prof. Ramnik Alowalia, Grooteskier Hospital CEO in absentia Dr. Bhavna Patel, Chairperson of the Central Drug Authority and Deputy Chairperson Ms. Nandima Tula-Khoza and Ms. Nomcebo Dlamini, Head of UCT Neuroscience Institute Prof. Regan, Head of Department of Psychiatry and Mental Health, and my boss, Prof. Dan Stein, Head of UCT, oh that's me, I can't say my own name, Health Science Student Council Chairperson, Ms. Naledi Mohale, and esteemed colleagues representing the National and Western Cape Provincial Departments of Social Development, the National Department of Justice and Correctional Services, the South African Medical Research Council and SAKENDU, the Sanka National and other representatives from the Western Cape treatment fraternity in the room and nationally online. Med Scheme, thank you, Dr. Facha. The International Technology Transfer Center team, all at the back there, the amazing people who work with me. Valued students in higher education, ladies and gentlemen joining us both in South Africa and from around the world. Thank you for joining us today. I'm going to be talking today about the Web App Assist, but I just wanted to say earlier that when I heard you all sing, I thought I was maybe at an Idols audition. I've never heard, I mean, the intonation, just brilliant. And the DG has saved me because he's given you the background of why substance use is so important. So you've given me the leeway to go straight to the tool. But I also think we're all very much aware of the importance of addressing substance use within our context. And I think importantly, which is part of the significance of the ITTC being located within UCT and within the Neuroscience Institute, is the intersectoral relevance of substance use and tackling substance use and getting a sense of where we are in terms of risk profiles around the country. We have to work together. We noticed that during lockdown, when there were restrictions on alcohol, suddenly our health system was free to deal with people's other health concerns. So if failing any other demonstration, at the very least, all of us, even in our most strongest denial that substance use is a problem in this country, we were able to objectively see during that period that that is in fact the case. So you will see there that there is a QR code. I would encourage everyone in this room and everyone online to please point your devices at that QR code. If you are challenged technologically or you have not upgraded to the latest device, it might give you a challenge. If it does, there will be a screen, a slide later on that gives the URL. But please do scan that QR code. And if you don't mind, as part of the practices of this engagement, then go ahead and select the self-screening pathway and screen yourself. What we'd like to do is to be able to share the outcomes of this process after this connection session. So please go ahead, but please don't despair. The QR code is on every slide, so you're not going to miss it. So what I'm going to do today is just talk about who we are as ITTC, where we're located, give you a very brief overview of, now we're all struggling with the QR code. You see, this is a problem with saying QR code. It's the same effect as saying there's food outside. All right, but this is the part you can miss. So it's fine if you can always get this on the recording, and then I'll talk about how the Web App Assist was developed. I'll talk about how what it's about, and then talk about strategies and next step. And all of those very beautiful people on my team. So the ITTC, or the International Technology Transfer Center in South Africa, is one of a few around the world. So what you see on the screen is the network of ITTCs. Now, because of time, I'm not going to go into too much detail about these, but you can certainly read up. The purpose is to drive implementation of best practice and development of best practice policy around the world. So you see the QR code is still there. Don't panic. Don't panic. It's going to be there throughout. So it's going to be there. So the ITTC works in collaboration with our drug demand partners around the world. So that includes United States Department of State, INL, the Colombo Plan Drug Advisory Program. We are a program of the International Consortium of Universities for Drug Demand Reduction and the International Society of Substance Use Professionals. What we're trying to say here is the work we do is not in isolation. We work as part of a network. Each piece of this network has particular expertise that we bring together in order to effect the program development and implementation that we then follow. Again, the theme I want, if you forget everything else I say, is working together collaboratively. Let's not start from scratch anymore. We know where the problems are. We know what my skills are. We know what your skills are. So let's pull them together and not work in silos. So that's what the network is aimed at doing. Everyone in the room knows because they're here right now. Everyone who's online, the ITTC and the Department of Addiction Psychiatry is based at University of Cape Town, down there at the bottom of the continent, and we're based at the Neuroscience Institute, which is within Groote Hospital. What are the aims and activities of the ITTC? I promise this all makes sense. I'll get to the tool in a moment. So the first purpose of the ITTC is to develop national and regional drug and alcohol policies that ultimately promote the implementation of evidence-based best practice for substance use prevention, treatment, and recovery in South Africa. And of course, our footprint then extends into SADC and on the African continent as well. So part of what we've delivered in providing these technical assistance interventions is the development of a national policy framework for screening, brief intervention, and referral to treatment with National Department of Health. We've worked with the African Union Commission to develop policy or initial groundwork for traditional leaders and health practitioners to assist in drug demand reduction. I think that's pretty straightforward English, but these are words we bandy around a lot. So drug demand reduction is really about reducing the likelihood people will start to use substances. If they do, reducing the likelihood they'll start using them harmfully. If they do, you're making sure that you manage them so that they don't progress to further illness. So that's really globally what drug demand reduction is. I'm sure somewhere there's a professor saying that's the wrong definition, but I think you kind of get the gist of what I'm saying. And so we're also working with the KZN Department of Health to develop an addiction center of excellent concept. The core of what my team does at the back is to expand the uptake of evidence-based best practice, and we do this through capacity building. So we provide training in motivational interviewing and screening, brief intervention, and referral to treatment. Never mind the error on the slide there, which is now being beamed internationally. We also facilitate training in detoxification and related capacity building for health practitioners in South Africa chiefly and in SADC by extension. We, alongside SANCA, produced the Addiction 2021 conference, which was markedly successful, and it showed that there's a real hunger and an appetite for engaging with best practice to manage substance use. And of course, Fergus is at the back with our postgraduate diploma of addictions care, which ITTC supports. We've also provided inputs to the colleges of medicine in terms of developing their curriculum to more responsibly represent substance use issues. Now, the part we all hear about is you cannot tackle a problem if you don't know the extent of the problem. So the key element that we are talking about today is the assessment and removal of barriers to evidence-based practice. So we've developed the policies, we've trained the providers, and we've trained the communities. But now, where must they go? What interventions must they put in place? The only way to know this is by knowing where the problems are. And that's where the Web Persist tool, you see there's a QR there. You see there's a QR, I told you, every slide, there's a QR. So that's what we're here to talk about today is the Web Persist tool. And we are also undertaking substance use resource mapping, which will be linked to the Assist tool. I won't bore you with that just yet. We'll have another party about that. What are the challenges we're trying to address? So we know the problems because we experience them in our communities. We see it in the news. We've seen Enyobeni. We've seen other issues. But there's no current comprehensive epidemiological data for mental health and substance use disorder. I mentioned that my boss is in the room. Many, many years ago, they did the only really representative epidemiological study in South Africa. So the data we have giving us an impression of the extent of substance use and mental health concerns in this country is over 12 years old at this point. It's really outdated. And we don't have passive risk data collection. So we know what the problems are, but we can't quantify them. So that's something that needs to be sorted. We also know that we have limited funding and human resource to immediately address these needs. So we know this. But we do have current strategies. We've got South African Medical Research Council here, who have this Sakendo program. Nadine, every time I say Sakendo, I mess it up, so I'm not going to do the whole thing. But if you Google Sakendo, you'll see. So Sakendo, on a 6-monthly basis, publishes treatment demand data. So Sakendo is able to tell us every 6 months, all the people that are coming for treatment, most of them are coming for cannabis, or most of them are coming for alcohol, most of them are coming for opioids, and region specific. So in KZN, we know what the preponderance of treatment seeking is focused on and across the country in that way. We also have limited indicators across provinces and national. So when practitioners see patients, they have a responsibility to then log what they've done. So through those indicators, we're able to have a sense of where the problems lie, but they're not detailed enough. all we're able to know now is a few questions were asked and someone was sent for treatment. But it doesn't give us a risk map. So it doesn't tell us where the problems lie. And that's what we're trying to answer here. But how did this come about? See, a QR code. This one big. There's a QR code, I told you. So how did the web app assist come about? Department of Correctional Services, who are in the room with us today, came to us and said, we know which substances we're seizing when clients, Prof, I have to. I'm sorry, I have to. So, you know, not everything escapes prison. So some things, like substances, are actually seized within the prison system. So we have a sense of which substances are being found, but we don't know the extent and nature of harmful substance use within the prison population. DCS also wanted us to be able to facilitate their ability to detect and intervene. So to provide a health intervention for inmates. Because remember, yes, we're really upset with these people, but they're also human, they have human rights. And part of rehabilitation is providing the care that will allow them to feel more human and integrate into society. So we do have to provide them with health services. So it's about enabling detection and intervention. And it's then to create capacity within corrections, so to train them. So I'm not going to go into detail, it's not the key today. But the essential piece which DG spoke to is that this data then drives our ability to develop policy and strategy. Only when we know the facts can we develop policy. So all the students in the room, even the ones who are rolling their eyes, one day you'll be standing here and you'll be like, oh, he was right, right? So the work that you do, this is something I tell my students all the time. Remember that your job is not just to become the professional or to acquire the degree, but it's to find a way to contribute to society. And part of that is solving challenges and contributing to policy and implementation of practice. So you're not just here to get a degree. You're here to become a contributing member of society. See, I had to do a bit of proffing. Okay, so what did we do with Department of Corrections? We trained the core management group to deliver screening, brief intervention, and a referral to treatment using the assist tool. And I'll say why in a moment. Those trained managers, some of them are in the room, were then able to go and train providers within corrections. Who are the providers within the correctional system? These are the wardens, these are the social practitioners and the health practitioners. So people within the prison system still get visits. So we're not throwing them. They get visits from social services to say, okay, where are you? What's the circumstances? How do we help you reintegrate? They get services from the health sector. How's your hypertension? You know, are you taking your ARVs, the TB, etc.? So they do receive, those are opportunities. So we trained through the management group these providers. We then provided the paper version of the assist tool to them to administer and piloted this process within corrections. And I'll show you some of the findings that came out of that. We were then able to provide an update of this data to the management committee of Department of Corrections, and they really received it with open arms. But what came about, as I mentioned earlier, is the logistical challenges. So, oh no, I mentioned it earlier in the closed briefing. I'm realizing maybe I also had it. So what you realize is that each facility must then complete the paper form. It must go centrally to Dr. Masoma's office. Dr. Masoma's office must collate them. They must be sent to UCT. My admin officer receives them. We send them to the data capturer. Data capturer captures them, makes a few mistakes. Maybe he didn't sleep last night. And then from there, they must go to the analysis team who must analyze. Then it must come back to me. Then I must say, no, that doesn't look right. So those are a lot of logistical problems. So we said, how do we remove all of this? How do we remove all of these? And that's how the Web Assist developed. But before I talk about the Web Assist very briefly again, this is what we found in terms of the initial pilot data of the assist within Department of Corrections. We collected both demographic and facility data, and what was heartening to us, I don't know if heartening is the right word, you know, English bundles start depleting, it's Monday, I don't know. So we found that the patterns of risk match the expected patterns, so that the data that we're able to get from Sakendo, the treatment demand data, And the data that I mentioned, Prof. Stein and team were able to elucidate 12 years ago, matched the patterns across the country in terms of the correction. So that was interesting for us. And we'll see as we get more data to what extent that continues to map. We found low levels of alcohol risk in keeping with restrictions. So we know it's not as easy to get alcohol in the correction system. It's easier to get other things, surprisingly, or to get out. I'm sorry. Sorry. I'm sorry, Prof. I had to. Okay. And so what we were able to see is that the comprehensive risk data ensures the ability to then plan services according to QR code. QR code. So if you haven't done it, if you're online, if you're here, please scan the QR code, because we'd love to share these findings with the group afterwards. So screen yourself. What is the assist? The VC actually did my VC. When you finished talking, I thought, why am I still going up? Was because you very ably outlined what the assist is and what the purpose of the Web Assist is. So the assist is the alcohol, smoking, and substance involvement screening test. It asks about substance use over the past 3 months, as well as assesses for lifetime risk. What makes it useful for us is it's one tool that covers a comprehensive list, which is long and includes tobacco and alcohol. You got a negative COVID test. Who's coughing? Can you yeah, we have things to do, man. So it comprises a comprehensive list of substances, so that's good for our context. It's one tool, so you don't have to go between tools. And once the assessment is done, there's a provision of a level of risk for each substance. Now, this is what makes it really valuable, is you're not just collecting risk data, you are then providing information and an intervention. So the second part of the tool, based on the scores that come back, is information and feedback about the risks and harms associated with each substance, which covers physical, medical, psychological risks of regular substance use. Now, a lot of the pushback, Prof. Dyer was talking about how a lot of footwork takes place. So this has been in the works for a very long period before we've come to share it with you. So we've engaged with stakeholders nationally, provincially. One of the things they said to us is, but the system's not ready. We don't have enough treatment providers. What do we do now if we detect all these people, but we can't offer them assistance? The reality, as you see highlighted in red, is that only a very small proportion of people who are screened actually need specialized care. In the interim, while you are trying to prove the burden and mobilize resources and advocate for resources, the brief interventions contained within the tool enable you to limit the people's likelihood to progress to more severe substance use. So you understand what I'm saying. So the brief intervention component is temporizing. So at the very least, you get the substance risk map. The next step, you at least do something in the meantime while services are not fully in place, while we work feverishly, collaboratively to develop that resource availability. Why the Web Assist? So I mentioned why we developed it. It's all those logistical challenges that we were trying to address. What's the value of the Web Assist? It's anonymized. So all of you who've scanned the QR code, I will not know who you are. There's no capturing of anything that is identifying that will link you. There's no personal identifying data. However, if we're doing a specific project, if we're doing a specific research project, and I'll show you what I mean, we can modify that. There's a random code, so at the end of the screen, you're able to see the random code in case you want to come back to us for some advice or etc. It can be used on any device, your smartphone, your tablet, your MacBook, your laptop if you haven't upgraded to a MacBook. All right, sorry, I had to. Your desktop, so you can use any device. It's data light. So in our context where we have power challenges that also limit our ability at times to access data burdened activities, that's really helpful. I say reduced training burden. The reality is there's no training burden. So whereas with the other paper version, everyone needed to be trained in how to use the tool, with this tool it's ready and automated, so anybody, which is why I say to you, go ahead and scan and you can screen yourself. And in so doing, you'll be able to see the ease of use. And of course, it's the ability to then report on patterns. use. So in settings, Minister, such as these, where a department might be doing engagements with communities, all one needs to do is to put the QR code for the self-screen. And in that way, community members or health seekers can then be able to screen and detect their own level of risk. For practitioners in the consulting room, if there's a QR code on the wall, while seeing their patient, they can be able to just quickly scan that. So that's the utility. But if they don't have the specific QR, they can go to the main landing page, which of course, as you saw when because you did what I told you, right? So when you went to the QR code, you would have seen that from that perspective, you're able to access those as well. So these are the pathways. I mentioned that we have self-screening. So all of you in the room were able to self-screen. This is for members of the public, including medical practitioners. So if you're concerned that you may have risky, we all know our levels of substance use. We might pretend we don't, but we do. So if you suspect that you might be using at a risky level, this is your chance, right? So the benefit here is the ability to self-administer and create self-efficacy. People must now take responsibility for their own well-being. We must, you know. As a society, especially, I'm going to get in trouble for this. You know, whenever you make a talk, you have to say something to get yourself in trouble. You can't have a clean talk. I think as a society, we're too used to waiting for services. We're too used to waiting for solutions to be brought to us. Whereas there's a responsibility to actually take on accountability. This allows you to do that for substance use. You can get your own level of risk and start to access interventions for yourself. There's practitioner screening, which I mentioned. We've created profiles for practitioners. So practitioners will register with us and they can screen providers. What's helpful about that is the transferability of the data. So if you go and see a practitioner in KwaZulu-Natal tomorrow, is it Natal? KwaZulu-Natal. The switching of accents. KwaZulu. That shows bias, Minister. So if you go to KwaZulu and you get screened and you show that this is the outcome you received from the web assist, and then you go to Vusta and that you get screened there's a different score. There's a reliability understanding. The same tool was used, the same mechanisms, the same scoring. So there's a transferability of data. Screening projects won't go into too much detail, but there are various special projects, such as the Department of Corrections project, such as the master's student. Prof. Green Thompson, we have an MEd student who's doing a study amongst medical students to ascertain the levels of risk within our faculty. So that's going to be super exciting to hear the outcomes of. So that's one of our initial special projects. I'm not going to go into this too much because you went to the QR code, right? So you've seen it. The purpose of the date of birth is to get you to the right. Everyone here, even though we're all youth, right? We're all youth, should have gone to the adult version. But if the age group is appropriate, it'll go to the other versions of the two for the youth. So again, I won't go into detail here. So what the value here is that once the scoring has been done, but perhaps maybe I should on this screen mention that. So these are all of the substances listed. And so if someone says, no, I have not, then that substance specifically falls away. So the practitioner doesn't have to remember which substances the client said yes or no to. And that's really part of the beginning of making it easier and automating. When you get to the end, you see here, these are the risk scores. So this was just a test client that we used. And it then indicates what intervention is required per substance that comes up. And you are then able to read all of the adverse effects, which are physical, psychological, emotional. You see they come in as a report. Then you can email that report to yourself. And again, we don't store that email address. And this is how the email comes through. So it shows risk level and shows the score, then provides the intervention that is recommended. In terms of linkage and access strategies, I mentioned the use of QR codes, which can be at public engagements, on social media campaigns, because we all spend so much of our lives on TikTok, Facebook, Instagram, so there's an opportunity for engagement there, strategically placed at public health facilities. So there's ways to engage practitioners, so these can be QR codes at public health facilities and other healthcare sites, and of course special projects as is appropriate. So what do we want to do next? We have achieved development of the tool. We've tested it. We've been able to show that even at sites such as Department of Corrections, where there are limitations in terms of network and power, that the tool still works well. So there haven't been any firewall challenges. We've strategized that we will disseminate the data through Sekendo, our friends at South African Medical Research Council. So that creates, that's about, again, creating sustainability through collaborating with folks who are already busy in the space. So we're not creating a new reporting pathway. And this data will then feed through to the World Drug Report. And of course, the idea is to facilitate the integration of these special projects with existing priorities, such as this project that we're going to hear about in two presentations that we hear about today, the Integrated Program for Social Crime, Substance Abuse, and Gender-Based Violence and Femicide. The next steps for the tool, Minister, are integration with Government Information System, the linkage to the geolocated resource directory, which is under development. What this means is that regardless of where someone is, they'll be able to see what substance use resources are in their vicinity, what services they provide, and how to contact them. So that's the next level of development that we're busy with. WHO, who is a close collaborator of ours, has given us permission to modify the tool VC. They've given us an opportunity to say, this is how cannabis is referred to in South Africa, so we will adapt it accordingly. And we will try to do the same as far as possible for other regions on the continent. And of course, it's to facilitate broad use external to South Africa. So Prof. Dyer spoke about Vision 2030. Nothing we do is just about UCT. It's just about South Africa. We are global citizens, so we need to think about the impact and how our developments can assist others in other. I didn't put my email address there because you guys email. It's a lot. But that's our contact details if you need to contact us. And those are our web pages in case you need to. So I hope that wasn't too fast, and I hope you get the gist of it. Shahima and Ayanda are going to come down just now and actually show you how the tool works so that you can see, even though you've seen already because you went to the QR code. So they'll come and show you. DG, thank you.
Okay, can you give the prof a hand one more time? Wonderful, very interesting stuff there, Prof. Now, Prof, tell me, while we wait for Shahima to come down, now, hey, I was doing this app here now. Hey, Prof, so Iri, you are a high risk. So, hey, I'm worried, Prof, that hey, if I do this app, Mari, you know what technology nowadays, even though you say it's anonymous, you track my phone and know who's the owner. So just thank you, but just take us into confidence that indeed, you know, we shouldn't be afraid to use the app. Our data, this data is safe and all of that stuff. I suppose my sister will also deal with some of that. But thank you very much, Prof, for the presentation. Let me hand over to Shahima. Shahima, right?
Yes, thank you. Good afternoon, everybody. Thank you, honorable guest. So I will be demonstrating the assist tool via the practitioner screening pathway, and I've got my actor here, Ayanda Mkhize. So we will play a demonstration. It's a role play. So please, it's just an act. It's not a real life. Can you stand aside for me, please? Okay, so you guys have self-screened already, but I'm going to show you now how it looks via the practitioner's pathway. So I feel like I'm very short, but I need to be behind here to demonstrate the tool so you can follow along on the screen as well. Okay, so Prof. Sibeko has given you the background of the tool, so I will now go in and show you the live demonstration via the practitioner screening. So I've already created an email address and a login detail, so you won't see, you'll have to create this yourself as a practitioner. Oh, this. Okay, so that's the start of the questionnaire. And then you have to type in some details as a practitioner. And then I'm just going to randomly choose where I'm based. Okay, Bongi, how are you doing today?
I'm okay, thank you. How are you?
I'm good. Bongi, before we continue with this screening tool, I will have to ask you your date of birth so that I get you the the correct version for your age. Okay, so can you please tell me what day you were born on?
On the 16th
16th, okay. And which month would that be?
April
April. And the year?
1993.
1993. Still very young. Okay, so welcome to the assist screening tool. I'm going to go through some data and consent information. So just remember, when you give me your information, the data that we enter will be de-identified and it won't be linked to your identity at all. So a random code will be generated and we may keep this on record just so that if you need to come back and retrieve some information, we can get that for you. At the end of the screening, there is an option for us to email it, or we can take a screenshot even of your screening scores. The system will not store the email address at all. Are we okay to continue?
Yes, we're okay, thanks.
Okay, great. Okay, so thank you for agreeing to take part of this screening tool. It's a brief interview about alcohol, tobacco products, and other drugs. I'm going to ask you some questions about your experiences using these substances across your lifetime, so your entire life, and also in the past 3 months. These substances can be swallowed, smoked, snorted, inhaled, injected, or taken in pill form. Let me just show you all the drugs that we will be asking you about. So this is the response card. We'll go through tobacco products, alcohol products, cannabis, cocaine, amphetamine, inhalants, sedatives, etc. So if you're not sure, you can just ask me and I can pull this back up. Okay, so let's move on. So before we continue with the actual screening tool, I'm going to collect some basic information about you, but just remember again, it's not linked to who you are, so it's just data for our systems. Is that okay?
Yes, it's okay.
Okay, so you can see on the screen of various options. So what is the sex that you identify as?
Female,
And the race group that you identify as?
African,
Okay. What is your present religion, if any?
Christianity.
Okay. You don't have to be nervous, okay? Whatever you tell me is confidential. Okay.
Trust you.
What is your marital status?
Married but separated, but I'm married.
So you're married, not separated. Okay. And what is your province of primary residence?
Western Cape,
Western Cape. Okay. And where in the Western Cape do you stay?
in Ops.
Obs, that's just down the road. Actually, we are in it. Okay, what is the highest level of education that you've completed?
I have a degree.
Oh, okay.
Mm,
It's a very fancy substance user. And what degree would you say that is?
a Bachelor of Education. I'm a teacher.
Okay, so we'll just type that in. Okay, and what is your current employment status?
Employed full-time.
Full-time. Okay, full-time employed. And at home, what is your support network? Who supports you at home?
My children and my parents and my spouse also.
So. Oh, keep it closer. Okay. Okay, you've got a good network going there for you.
I tried, thanks.
Okay, so now we're going to go into the assist screening tool. There are 8 questions, and the first question is asking about substances that you've used ever in your life. So even if you've used it like just once, you can select yes. So you can tell me what you've been using, and as a reminder, that is the various substances that we'll go through. So have you used tobacco products ever in your life? Like cigarettes?
Yes, I have.
Okay. And alcoholic beverages? Any alcohol, beer,
Who
wine?
hasn't? Yes.
And cannabis, so like dacha, they call it dacha or marijuana.
Of course, that as well.
Okay. Have you used any cocaine in your life?
No, I've never.
Never. It's expensive, no?
It's too expensive, I can't.
Okay, so have you used any amphetamine type stimulants? So things like methamphetamine, ecstasy?
No,
Tap-
I've never.
Never?
No.
Okay, never. And any inhalants, have you used any inhalants like glue, sniffing like a paraffin?
No.
No, okay. Have you used any sedatives or sleeping pills in a like non-prescribed way?
No.
No. Hallucinogens, so things like mushrooms, acid, LSD. Have you used any of that in your life?
No, not yet.
Not yet, okay. Have you used any opioids? So things like heroin, hunga, unga, morphine, codeine-based tablets?
No.
No? Okay. Is there anything else that you might have used ever in your life? Like even if it was just once when you were a teenager or anything that you're currently using that you can't see on the list?
I don't see Mandrax on your list, but I use it as well.
Okay. So Mandrax. Okay, let's add Mandrax to the list. I can certainly still screen for that.
Okay, thanks.
Okay, so let's move on to question 2. So question 2 is now asking about all the substances that you said yes to, but in the past 3 months, how often have you used it? So before we go to the responses, I just want to show you what the responses might be. So for questions 2 to 5, we've got never, so not used in the last 3 months, once or twice, which is 1 to 2 times in the last 3 months, monthly, 1 to 3 times in a month, weekly, which is 1 to 4 times a week, or daily or almost daily. Is that okay?
Okay, makes sense, thanks.
Okay. If you're not sure, you can just tell me and I'll show you again. Okay, so for tobacco, in the past 3 months, how often have you used the tobacco products, the cigarettes? It's cigarettes, eh?
Yeah, cigarettes. I use it every day.
Every day? Okay.
Yes.
So daily or almost daily?
Yeah, almost daily, yeah.
And alcohol, how often would you say you are using that in the past 3 months?
Ooh, in the past 3 months, it's been daily. Yeah. Yeah, it's been daily.
Okay. Okay, so you're using that daily. And
Yeah.
for the dacha, how often would you say that is?
Every day as well.
Every day.
Every
Okay.
day.
I'm not judging you, yeah.
Thank you.
Okay, and the Mandrax, how often would you say you're using that in the past 3 months?
Maybe once or twice.
Once or twice. Okay.
Not all the time.
Not all the time. No problem. Okay, question 3. During the past 3 months, how often have you had a strong urge or desire to use cigarettes? How
Every single day.
is that every single
Yes.
daily, almost daily? Okay. And alcohol, how often would you say that is? That urge or craving?
Okay, the urge, it's also every day.
Every day.
Yeah.
Okay. And the dacha, how often would you say that?
The urge is also, it's persistent every
Every
single
day.
day.
So you
yes.
do need it every day.
I do need it every day.
Okay. And the Mandrax, how often would you say that urge is?
No, that was like a once or twice thing. That's
Once
an
or twice.
occasional thing. So the
Ah.
cravings aren't that much for
Okay,
me.
cool. Okay, we're nearly halfway there. During the past 3 months, how often has your use of cigarettes perhaps led to some health, social, or legal problems? So, like, do any of these substances affect like your health? You end up in at the doctor, or is there relationship problems, or have you ended up with legal issues? So, for cigarettes, has there been any?
No.
No. Okay. And alcohol, any problems there?
Many problems.
Many
like,
problems. Okay.
So almost every day
Oh,
there
wow.
are problems.
There are
There are
problems.
problems at home almost every day.
Okay. That's probably why you separated, eh?
That's why I'm separated. Yeah.
Okay.
These little things.
Okay. And the dacha, would you say that has led to anything?
No, not
No.
yet. No, nothing's happened.
Nothing. Okay. And the Mandrax?
No, never.
Never. Okay. Thanks, Bongi, for being so honest about this. So question 5, during the past 3 months, how often have you failed to do what was normally expected of you because of using these substances or alcohol? So you perhaps can't do your duties at home or at work. Alcohol, how often has that happened?
I don't know, maybe once or twice. I forget to fetch my child from school sometimes.
okay.
So let's say once or twice.
Once or twice. Okay, I'm sorry about that. And the dacha, would you say that has led to any problems? Or like
No, never.
never. And the Mandrax?
Yes, once, because yeah, the one time I took it, there was some problems.
Some problems happened from
Yes,
that.
yeah.
Okay. Only once.
Mm.
Okay.
Many problems came from that one time. Though.
Oh, okay. Okay, so now we just got a couple more questions, but I just want to tell you what the responses are for questions 6 to 8. So the response card shows the responses are either no, never, yes, but not in the past 3 months, or yes, it has happened in the past 3 months. Okay, so has a friend or relative or anyone else ever expressed concern about your use of substances? So here it's again that ever question, so ever in your life for these substances. So for tobacco, has anybody expressed any concern?
Yes, but not in the past 3 months.
Not in the past 3 months. Okay, not in the past 3 months. And the alcohol, has that caused any? Has anybody?
Yes, yesterday. So in the past 3 months.
Yesterday. Okay. And the dacha? Anybody
dacha-
express concern?
No, not in the past 3 months.
Not in the past. But they have.
There has been concern. Yes,
Okay.
there has been.
I just wanted to clarify. And the mandrax, has anybody expressed concern about that?
Yes, in the past 3 months.
Yes, in the past 3 months. It sounds like that one time was
That
quite...
one time was quite something.
Okay. Okay, question 7. Have you tried, failed, or controlled to cut down or stop using any of these substances ever? So the cigarettes, have you ever tried and failed? to cut
No,
down?
I've
No?
never tried.
Never tried. And the alcohol, have you ever tried?
Yes,
Failed.
but not in the last 3 months.
Okay, so you haven't tried again.
I haven't tried
recently.
again, no.
Okay. The dacha, have you tried to cut down or control that use?
Yes, in the past 3 months.
It's also recently.
Mm.
Okay. The mandrax, have you tried to cut down on that?
Yes, in the past 3 months.
Okay. Sounds rough. Okay, this is the last question. So have you ever used any drug by injection? So ever, even if it's just once. Have you ever used by injection?
No,
No.
I've never.
Okay, that's good to hear. Okay, Bongi, that's the end of the questions. So this is your summary of your scores and the recommended intervention. So as you can see, for cigarettes and dacha and mandrax, the recommended intervention is a brief intervention, but for alcohol, more intensive treatment is recommended. Would you like to see a full report of this?
Yes, please.
Okay. So as you can see, for those 3 that I mentioned now, tobacco, cannabis, and mandrax, you're at moderate risk level. And so you're putting yourself at risk of health and other problems because of your current pattern of use. For alcohol, you're on very high risk. And this means that you are at high risk of experiencing severe problems like health, social, legal, relationship problems. And I think you've
Yes.
already mentioned some of those.
Major, yeah.
Okay. Are you concerned about your substance use or alcohol use?
I'm very concerned. That's why I came to speak to you today.
Okay, I'm very glad that you have come. I can go into more detail about what the level of risk means for each of these substances, but for time's sake, I can just briefly just show it to you, and then in our next session we can go through it in more detail. Is that okay with you?
Yes, that's okay. Thank you.
Okay, so you can see for cigarettes, you're at moderate risk, and so you may already be experiencing all of these, but you'll see, I'll share this information with you. There's also the risk for alcohol use, which is at very high risk, which is a concern. I will have to discuss with you further assessment and a referral to treatment for that. But for the others, it's moderate, so brief intervention is recommended. Would you like me to share this information with you?
Yes, please
Okay.
email it to me.
Must I email it to you?
Mm.
Okay. I mean, yeah. Okay, that's the end of our session. Thank you so much for being honest.
Thank you.
Let's appreciate them one more time. Let's give them a hand one more time. Prof, this tool is asking a lot of questions, man. And hey, we're going to end up saying things here which are, hey, maybe problematic. But I like the fact that we're learning that there's new types of drugs or different types of drugs. My sister there was educating me behind me, saying, why do you still call marijuana marijuana? It's Mary Jane. You know? She says you must find nice words for it. So it's Mary Jane. You all know which sisters. There's a few of them behind me. But Prof, thank you very much. And I think this is a useful tool. Even though it said I'm a high risk, I must go for interventions. Like my sister there, so I'm not alone, you see. Don't be afraid to utilize it. And I like, Prof, there's one thing I particularly like about what you said. You said that it's time that we take responsibility for our own well-being. I think that's important. Sometimes we want to blame government, we want to blame where we come from, we want to blame our families, we want to blame our background, but there is a need for us to sit back and think like adults and take responsibility for our own actions. So that's very, very useful, and I think it was an important message that came across from the presentation. Now, what I also like about what you said is the importance of working together. Now, look, it's not possible. Are there any students here from UCT? Over here. Right. So, or any other university. So, all right, there we go. I forgot. So, you see, it's not possible. It's not possible to be in this institution and live here without adequate knowledge. I mean, this is a university. It's a research institution. It's a, what did you call it, Prof? A neuroscience institution. Man, it's even a hospital. So if you have problems, everything is around you to resolve. So when you leave here, you should leave smarter, right? So there's no excuse for anybody to leave this institution not knowing what help to get and not leaving in a better condition than when they did. So we're going to hear a little bit from the students now, and I'm going to call upon to speak on behalf of the students very briefly is the chairperson of the UCT Health Sciences Students Council, and that's Ms. Naledi Mohale. Can you give her a hand? Thank you, Ms. Naledi. Over to you.
Good afternoon to our esteemed guests and the floor at large, all protocol observed. It is truly an honor to be asked to speak at such an auspicious occasion. My name is Naledi Mohale. I'm a fourth-year medical student and the current chairperson of the UCT Health Sciences Students Council. I come from a city in the Eastern Cape called East London. I'm not sure if anyone is from there. East London represent! Now the question that usually follows when I tell people where I'm from is how? Naledi, Mohale, wako East London, Zhuang. Raising the question of how very Sue to me is born and raised in a very Xhosa city and province. But yes, I hail from the self-proclaimed home of legends. Sorry to the other provinces. Much like many of my peers, coming to university was the first time I had been away from home, and the first time I'd come to a city as big and as vast in activity as Cape Town. The first part of that statement presents its own set of challenges, because not only did it mean coming to terms with what being an adult truly means, and really understanding what parental favorite phrases like "there's food at home" mean. And with the recent increase in interest rates, there really is food at home, hey? But it also meant keeping myself alive and afloat, and as easy as my mom made it look, it proved to be quite a difficult task. I think all the university students here can relate to what a rude awakening adulting really is. The second part of my initial statement then compounds that first challenge, because as we all know, Cape Town is a city full of opportunity. Opportunity in different forms. Opportunity that isn't always as readily available in East London. An opportunity that, of course, is not always good. As you can imagine, that can be quite overwhelming for a little first year who has never been exposed to many of this. Luckily for me, I came with and made a really great group of friends who made sure that in and amongst the hustle and bustle of Cape Town, I always remained grounded and focused in the reason I came here. Unfortunately, some of my peers are not that lucky and end up victims of things such as substance abuse, crime, and gender-based violence. And as the alarming stories of students who lose their lives at the hands of their peers will remind us, some are even perpetrators thereof. It is not a secret that South Africa has one of the highest instances of crime and gender-based violence in the world. Not on the continent, in the world. And the people involved in it have become closer and closer to our age as the youth. As a generation of doers, a generation of youth who epitomize being the change that we want to see, we often ask ourselves the question of what more we can do to curb these social ills. That is why it is so important for resources such as the Assist app to exist. Not only does this app give the opportunity for early identification of risk factors, but most importantly, because the screening tool can be self-administered, it allows for empowered intervention. There is great power in not taking away autonomy in intervention, in allowing people to identify and recognize the need by themselves for them to change and to understand what they need to change. The point of sustainability is also a very important one for the app. The change that we need to see is one that does not require brief motivational talks or intermittent anti-crime and anti-GBV drives, but solutions that will be ever evolving and everlasting. Solutions that will outlive each and every one of us here. In these solutions, we then hope to create a university experience for all that is an educational experience and one of personal growth. An experience that is not clouded by crime, an experience that is not marred by constant fear, an experience that is deserved by each and every student entering tertiary institutions in South Africa. And that is the type of future that interventions such as the Assist app give us hope of one day achieving. Thank you.
I want to shake your hand. Good job. Prof, the English bundles are full here. Thank you very much, Ms. Mohali from the Eastern Cape. It does sound weird, but thank you very much for representing the students so well. And it's a very important issue that you raised. Students are becoming perpetrators as well as victims. And it's becoming very difficult to talk about gender-based violence, crime, without talking about substance abuse in the same sentence. So very critical message that you've put across. I really appreciate it. And I hope that this thing would sink in, right? And that we'd be conscious in our daily lives as students here. So we're going to go to the next speaker very quickly, and I'm going to ask Ms. Aruna Singh from the Department of Higher Education and Training. She's got a flight to catch, and so we brought her up in the program. We don't want to leave her, or we don't want to add to her flight being delayed. So she's going to speak to you very briefly and provide a message of support on behalf of the Department of Higher Education and Training. Can you put your hands together for her?
Thank you very much, Program Director, and thank you for accommodating me, and my apologies for that. Honorable Minister Lindiwe Zulu, Director General of Social Development, and other senior officials of the Department of Social Development, officials of the Department of Correctional Services, heads of social development entities whom I'm aware are here and have been involved in this particular initiative, Vice Chancellor Professor Daya Reddy and the UCT colleagues, Professor Ramnika Luwalia from Higher Health, students, student representatives, and guests. A very good afternoon to all of you. And as the program director has indicated, my role is really to provide support to this very valuable initiative on behalf of the Department of Higher Education and Training and the ministry. So it is my pleasure to represent both the department and the Ministry of Higher Education, Science and Innovation on this very significant occasion of the launch of the web app Assist. And finally, I managed to capture what the acronym is. Very interesting. Which aims to address, in an overarching way, the mental health challenges faced by our youth in respect of substance use disorder is what we are calling it. And in this instance, specifically in our institutions of higher learning. Globally, about 1 in 8 people in the world live with a mental disorder, with onset predominantly prior to the age of 24. In South Africa, mental disorder occurrence in a 24-month cycle stands, which means if you have to evaluate someone in a 12-month cycle, the incidence rate stands at 12.5%, with 2% constituting severe mental disorder. Now, drugs, alcohol, and related substance abuse falls within this broader ambit of substance use disorder. The social, economic, personal, societal, and family impacts are far-reaching, detrimental, and destructive to every context in which substance abuse occurs. Whilst the loss of life is always and should be our paramount concern, the impact on life and lives themselves are phenomenal. Constant and debilitating use of harmful substances not only destroy families, destroy careers, they destroy incomes, but also destroy or robs a country of its future. Correctly so, we must invest in our youth, but collaterally, there has to be returns for the sake of development and growth in our country. And for this, we rely on our future generations. It is for these reasons in the main that we see the web app tool, Assist, as a vital tool for detection and intervention as a holistic response in dealing with the scourge of substance abuse. Alcohol consumption sits remarkably high among both staff and students. Statistics that will be provided by Dr. Aluwalia later in the program will testify to this, as well as the impact and perpetuation of a myriad of other social ills, such as GBV generally and sexual violence in particular. It is the fervent appeal of the ministry and the department that leaders in our institutions of higher learning commit to supporting and implementing this web app across all institutions. This requires careful planning for effective implementation in order to realize the desired outcomes. We are confident that this will happen. It is also our desire that the app reaches our TVET colleges, where we find that alcohol abuse specifically sits, alcohol abuse in particular, not general substance abuse, we are talking about alcohol abuse, specifically sits at around 60% among students and around 58% among staff. These statistics are of grave concern to us, as you can well imagine. Finally, I take this opportunity to congratulate the UCT Faculty of Health Sciences on the launch of this web app, Assist, which is very aptly named, and wish you every success in its rollout across our institutions. Be assured of the department's support in all such endeavors to assist and develop our youth. I thank you very much.
Thank you very much, Madam. Please don't be late for your flight, and thank you for a very powerful message on behalf of the Department of Higher Education, Science and Technology. You cannot not know that department. Apart from the fact that they pay for us to be here, some of us doing NSFES, yeah, they're also playing an important role, and maybe the Minister will speak a little bit later around how we have partnered with NSFES as the Department of Social Development for all grant recipients to get into university without doing any means testing. So in other words, if you do well and you're a grant recipient, and by the way, grant recipients are from 0, from when you're born, all the way up to 18, on the child support grant, you are actually able to get a free education through government. Shouldn't you just love our government? No? How can you not? You know, so we're able to do that and provide free education to young people who come from impoverished backgrounds. And I think that that's an important aspect, and we appreciate the work that we're doing together with the Department of Higher Education and Science and Technology. So thank you very much one more time, Ms. Singh, for that message of support. Thank you. Can you give her a hand one more time? Encourage her. I'd like to, I promise you we have 2 more speakers and then it's going to get a little bit more real. Can we ask Higher Health CEO, Professor Ramnik Aluwali, to come up? Can you give him a hand? Thank you. He's going to speak to you from High Health side.
Colleagues, I'll be very brief because I think time is against us and I think the Minister is still waiting. And Minister, greetings to you, Vice Chancellor. Maybe the best is to say all protocols observed and everybody's acknowledged. Professor Goodman, fantastic work. It's an absolute honor to listen to this. What I am here is to pledge with you our commitment to you. And I think as Department of Higher Education has rightfully said, Higher Health stands behind this. We're already doing screenings and we just think that how do we integrate these screenings to make it more relevant for our youth in general. I just thought I'd have a very quick presentation, but I won't go longer. Higher Health, you know, post-school education is this big. You know, UCT is one big element of our post-school education, but I'll represent technical vocational colleges, the community college system. It's quite a lot. We're talking about 2.5 million youth here, and that is what I will be addressing. Minister, we believe civic education is a solution. I think that's your biggest mandate as a Department of Social Development, building a good citizen. I think, is there anything on this slide that anyone tell me which is not interconnected? So we can't treat drugs and alcohol separate. They're not talking about gender-based violence. 65% of GBV in South Africa is preceded by drugs and alcohol, as per WHO, which is predominantly the highest in the world. The country next to us is United States, which is about 58%. Tell me, mental health and drugs and alcohol, can you disassociate two? So you have to teach mental health, and then only you can talk about drugs and alcohol. What is drugs and alcohol? Direct correlation with HIV and unplanned pregnancies in South Africa. Gender diversity, according to Higher Health study, 70% of our students who are LGBTQI+ are abusing drugs and alcohol because of the stigma we create for them. 5% of the total population is gender diverse in higher education. Going further, so anything in this slide you will see, and that's why I want to talk about the mother of all, which is civic education. So Higher Health studies shows once you start drinking, you have made many friends drinking with you. This is a student who says, I drink whiskey and I drink beer, I drink heavily on weekends, but during the week I have about 3 or 4 dumpies. I don't pass out, I just get drunk. 60% of our TVET students abuse drugs and alcohol every month. 35% in our universities, I don't know how far the data will be correct. This is as per Higher Health sampling of data. Across all 26 public universities, and the TVET data is across all 50 public TVET colleges in sampling. So I don't want to go deeper, but we have a problem. It's a solution. So I give you one solution as higher health, and I partner Professor Goodman into it. We with QCTO, which is SAQA and Quality Assurance South Africa, and Health and Welfare CETA are launching an NQF level 5, which is higher certificate, qualification, a skills program. So this is the 7 modules that you will learn every foundation phase when you're entering. The first is good citizenship, Minister, civic education. Save our democracy, build a good citizen. Till when we'll see abuse in our families or, single mothers raising kids, we need to talk about our constitution. We need to respect every line of our national anthem and every word of what it means to you. And I think we need to learn this. We need to go back to our basics. The second module is gender. Everything about gender. Gender diversity, gender-based violence. You get 5 credits if you do each module. Mental health, disability, communicable diseases, HIV, TB, STI, sexual reproductive health. And module 6 is drugs and alcohol and resilience. 7th is climate change. Why am I saying this? Is because we really have an issue in this country. And the only way we can sort us is by this campaign called Each One Reach and Teach 10. Minister, before apartheid, we used to do each one and reach and teach 1. We changed it to reach and teach 10. What I am calling on is every young South African student who does this curriculum, because we're trying to persuade the Vice Chancellor's principles as a co-curriculum in the post-school education, your foundation phases. We already have 700,000 students enrolled into this curriculum. So it's not small, 700,000 young South Africans, which means if each one reach and teach 10 possible, we reach 7 million in our communities. So each South African student must reach 10 people in the community. It's part of your curriculum. It's part of your qualification. And that's your community giving or your community engagement. You learn better by teaching others. So when I'm teaching you, I'm learning better. I'm being selfish here. So same as you, her peer to peer. So 10 people. So this is a participatory pedagogy. You get your curriculum done. So you can be NQF 1, NQF level 2. You go straight to NQF level 5 because this is the only curriculum where the entry requirement is you should be just registered in the post-school education. You do not need to be showing that you are a matric. So you can be grade 8 and you are in a TVET college or you are in a community college. You can do this very, very quickly in this life. 10 soft skills. We have to sort out drugs and alcohol. The 10 soft skills are required in your workplace. You are doing engineering, you're doing humanities, you're doing social sciences, you're doing engineering, or you're doing, mining, plumbing. You need these 10 soft skills. So this curriculum, as much as it entails on civic education, on building your epidemics or challenges like drugs and alcohol, builds you with resilience on the 10 soft skills automatically, which are a tick box on your CV. So what you get, an NQF level 5 on civic. Learn drugs and alcohol by connecting with GBV, with mental health, with issues of HIV, TB, STI, climate change, and become a good citizen. And that's my solution of thinking how we can fight many epidemics together as what social challenges we have in our midst. So what you get to strengthen your CV, you get an extra skills qualification of NQF 5, simple by doing others, by teaching others. We promote building good citizenship, and Minister, we build social entrepreneurials. 30% of jobs in South Africa are in non-for-profit. Do this and build another life. Build it around engineering, build it around mathematics. And that's what we want in South Africa. And of course, we're going to be very hard to our people who are in residences. We are saying to you, do this alcohol and drugs and GBV curriculum and mental health. If you are in private security, you have to do gender-based violence if you have to work in the system. Because these are important parameters for us when we're dealing with the youth in general. I'm concluding. I want the minister to speak. Colleagues, help. So higher health pledges, Professor Goodman, that we reach 80% of our post-school system. Last year, our data will show you about 1.5 million students are beneficiaries of higher health. 730,000 enter this curriculum. our curriculum already is inbuilt with all the diseases I told you, all the social challenges. Everybody has a risk assessment toolkit, which is peer reviewed. The assist is the next layer in drugs and alcohol. So, and what we're going to do is we're going to integrate because this is all digital. So colleagues, you can do it on your phone, this curriculum, and get an NQ of 5. That's how simple life is. Do you understand me? So it's face-to-face, but it's also digital. So we're going to use our digital curriculum to connect with assist and integrate into our drugs and alcohol curriculum. So when the risk screenings are happening, students are going to the next stages. As soon as they're identified through higher health a mild risk, they'll automatically go into the bigger assist to get into details of everything. So similarly, we have tool risks inbuilt into it. So we commit to you, Professor Goodman. We are very excited. We have 10,000 peer educators. We're very proud of some of the UWC peer educators. We're very proud, love you guys. And you are real South Africa. Minister, they volunteer when they join the post-school education system. There are 10,000 of higher health army of foot soldiers, and some of them are here. They dedicate their life. They're student volunteers. They get nothing except for this qualification, but they give back through the peer-to-peer. These 100 students, warriors of UWC probably are looking after the 10,000 UWC student population in general. So I'm very proud of all of you. Take the drugs and alcohol to the next level. Thank you very much, colleagues.
I must say, Prof, you're very popular. Yeah, thank you very much. You're very popular. Can the volunteers stand? Can we appreciate them? Keep on keeping on, guys. You're doing a good job. And I know the Prof said, listen. I know the Prof said, you know, I wonder if we could challenge a number of institutions around this program. I wonder if we made it a prerequisite, VC and Dean, that for every student leader, everybody who wants to be a leader should go through that. Because I think it's important. Those are fundamental aspects you're talking about there. And I think everybody should really, you know, I think we'd like to talk a little bit more around that, especially the volunteerism part. That's very important for us. I'm sure Minister may talk a little bit about it later. But I know the Prof said you're getting nothing, but for me, you're going to walk away with something today. So I feel like Oprah when she says, you're getting one, you're getting one, yeah. So, yeah. So we'll make sure you get a little something before you walk out of here today. So thank you very much. And thanks again, Prof. I particularly like, and I know that the program is slightly delayed. I want us to push a little bit. But, you know, if there's one thing that came out of this presentation, is this aspect of civic education. It's core. It's so cool. We can get so busy doing so many things, but if we don't empower ourselves to empower others in our communities, we're in trouble. So this aspect of civil education is paramount, and thank you very much for that, Prof. Right, I promise you we have one last speaker, then we're going to hear from the Minister. I'd like to call upon to talk on behalf of the Department of Correctional Services very, very quickly and very, very briefly is the Deputy Commissioner for Incarceration and Corrections, Ms. Anna Molepo. If you could put your hands together for her quickly. She may advise you how not to get to where Thabo Bester was. She may go into a little bit of Thabo Bester, maybe not, but let's see.
Thank you very much, Program Director. Good afternoon to the Honorable Minister of Social Development, Minister Lindiwe Zulu, the Acting Director, Director General of Social Development, UCT Vice Chancellor, Professor Daya Reddy, CEO of Higher Health, Ms. Professor Alualia, and UCT Faculty of Health Sciences, Dean Professor Lionel Green Thompson. To partners and stakeholders, esteemed guests, students, and all protocol observed. My name, as already indicated, is Anna Molepo. I'm the Chief Deputy Commissioner responsible for incarceration and corrections, and I'm here representing the National Commissioner of the Department of Correctional Services. Program Director, I know that you've indicated that time is limited, but I just want to give a bit of a background of correctional services so that people can understand what correctional services is doing. Let me first start by sharing the mandate of the Department of Correctional Services in order for us to understand the roles and responsibilities of the department and the collaboration between the DCS and UCT in rolling out the pilot alcohol, smoking, and substance involvement screening test, that is the ASSIST project that Professor Sibeko presented. And that has led to the development of the web app ASSIST, which is being launched today. The purpose of correctional system is to contribute to maintaining and protecting a just, peaceful and safe society by enforcing sentences of the courts in the manner prescribed by the Correctional Services Act and detaining all inmates in safe custody while ensuring their humane dignity. We are promoting the social responsibility and human development of all sentenced offenders and persons under community corrections. Those are our parolees and probationers. Health and safety, dignity, social responsibility, and human development are values derived from the Constitution that gives expression to the daily functioning of our correctional services. Program Director, in simple terms, our mandate is threefold: is to incarcerate, to rehabilitate, and to ensure that they are integrated back into the society. So just in simple terms, those are the three-legged mandate, just to simplify it. Nationally, we do have 243 correctional centers nationally, and our correctional facilities, they are distributed per security classification or category. That is, we have maximum correctional facilities, we also have medium correctional facilities, we also have juvenile correctional facilities. So out of the 243, in terms of the region, in Western Cape we have 44, Eastern Cape 45, Free State and Northern Cape we have 48, KZN 42, and LMN 38. Program Director, I'm just going to provide statistics to show the numbers of inmates in our correctional facilities so that we do understand the vast number of our people who committed various crimes. As at 31st March, we had a total inmate population of 157,000, which is quite a big number. And out of that, we have 101 sentenced offenders and 55,000 unsentenced offenders. That is the remand detainees, those that are still awaiting trial. So the number is quite high, it's 55,000. And out of this total inmate population, we have about 44,219 sentenced youth population. The youth is ranging from 21 to 35 years. That's how we define it within correctional services. That is that 44,000. And out of this 44,000, we have 32,000, that is 72%, that is classified as maximums. So 32,000, those that are classified as maximums, meaning that they have committed violent crimes. So it's 32,000. And we also have 12,190, which are medium sentenced offenders. So the medium sentenced offenders, they have committed non-violent crimes. Program Director, the statistics within our facilities shows that the number of youth is increasing drastically, and it is indeed concerning. This clearly shows that early detection and prevention of substance abuse would assist our youth not to commit crime, especially those that are linked to the alcohol and substance abuse. Professor Sibeko, the implementation of the web app alcohol, smoking and substance involvement screening will be very much helpful for early detection. It is against this background that there was collaboration between DCS and International Technology Training Center, which led to the development of assist tool. I'm not going to go into the background with regard to that. Professor Sibeko already outlined the collaboration that we had between the DCS and ITTC. The department acknowledges the role of alcohol and drug abuse in the commission of crime. Hence, we continually provide substance abuse program for those whose rehabilitation is dependent on its completion. Inmates are persistently encouraged to have responsible attitudes towards prescribed drugs, both while in a correctional facility and following release, through education and counseling, and those addicted to drugs or have other health problems that are offered. The most important issue with regard to the web app assist is that our collaboration with UCT, that is ITTC, led to the training of 18 master trainers in the use of alcohol, smoking and substance involvement screening tests. And then those master trainers have trained the DCS providers in the delivery of screening, brief intervention and referral to treatment in daily practice. Generally, DCS providers who have been trained by master trainers include health practitioners like doctors, nurses and pharmacists, and other professionals who were trained include psychologists, religious workers, social workers, and other correctional officials, that is our warders. A program director, the master trainers are constituted of professionals and non-professionals from both head office and all the regions. The implementation of the assist tool will produce findings that will assist the department in enhancing the evidence-based rehabilitation programs, and also the development and or review of policies and procedures on substance abuse within correctional facilities. Remember, I said the mandate is three-legged. It's incarceration, rehabilitation, and social reintegration. So the findings of this tool will assist in terms of ensuring that our rehabilitation programs are evidence-based. So the findings will assist us to ensure that we do not just develop programs that are not going to be specific to the needs. So those programs will be needs-based. DCS assist projects make use of risk categories determined by screening scores to help determine the ideal intervention strategy. We really appreciate that the screening for substance abuse disorder is moved from paper-based tool to an electronic tool, which will provide real-time information, especially of those at high risk needing immediate or urgent attention for treatment. Our correctional facilities should provide opportunities for prevention and early intervention. We are legislated by Correctional Services Act, which requires that offenders must be assessed and profiled. And for that, we have developed a correctional sentence plan, which needs to be compiled. So at assessment, we have to ensure that the correctional sentence plan is being compiled. So this correctional sentence plan is a tool that is utilized to assess the needs and risks of offenders according to the offense committed, and outlines needs-based interventions to be undertaken by each offender. So that will be in addition to the tool that is being used. Remember, the tool is more specific to substance abuse, and the correctional sentence plan is entirely on all programs that will be identified, like education needs, developmental needs, rehabilitation needs, social reintegration needs, other needs that are not being catered for under the web assist tool. So in an effort to offer better rehabilitative services to offenders, we do have various rehabilitation programs such as education, social work, psychological and spiritual care services, and those have been developed according to major crime categories and have been successfully rendered to offenders. We are currently implementing 13 endorsed correctional programs that are aimed at criminogenic factors of crime and will immensely contribute in the rehabilitation and reintegration of offenders upon their release. One of those programs, like out of those 13 programs, one of those programs is substance abuse. We call it Stop to Start, which assists offenders with substance-related problems to gain insight into the negative effects of substance abuse. So these 13 correctional programs, they are non-therapeutic in nature, and they focus on raising awareness, providing information, as well as developing life skills. And implementation of these programs would form part of brief interventions in line with screening, brief intervention, and referral to treatment. During the role play, the findings has shown that there is a need for brief intervention. So from Correctional Services side, that brief intervention will be these correctional programs that I'm saying they are non-therapeutic. So they are more on raising awareness, though more on life skills. The more intensive programs, as we have seen during the role play, the one that the lady was supposed to do, the intensive one, for us, it will be more of those programs that will be rendered by psychologists, by social workers, and other professionals. That will be the therapeutic programs to be rendered to our offenders. So some of the programs rendered by social workers include anger management, substance abuse, sexual offender treatment, marriage, family care and relationships, life skills, youth resilience, and others. A program director, in concluding, I would like to emphasize that corrections is a societal responsibility. So as the department, we will not be able to achieve our mandate without collaborating with other government departments, with other NGOs, FBOs, institutions of higher learning, and other government departments in ensuring that our offenders are successfully reintegrated back into the society. Program Director, thank you very much.
Thank you. Thank you very much, Madam. Some very interesting statistics there. And I think it must shock us, the number of youth that are incarcerated. These are young kids or youth that have created or have been involved in some very dangerous crimes. So I do hope that in your universities, in your communities at home, you're able to address some of the challenges that would avoid young people, especially youth, getting into or being incarcerated, because it's not a good thing. And if you just take a visit to a prison and go and see how bad it is, you wouldn't want to land up there. So do encourage those. And I think I particularly like the fact that you focused a lot on the fact that your programs are very needs-based and are informed by evidence-based research. I think that's important because it in a way talks to the needs on the ground and specific. So you're not developing programs in the air, but they are targeted. And I think that's quite important. So thank you very much for that. A very useful presentation. I wonder if you could share some of this information, make it widely available. And whilst I'm on that note, there is an exhibition outside, which I hope you would get a chance to go through and see and take some information, because information is power. If you're not informed, you would not know about a range of things. Just like how I found out that marijuana today is now Mary Jane, kind of a thing. So information is power. So it's important. When they talk about Mary Jane, I know what they're talking about now. You're not going to pull the wool over my eyes and talk, Mary Jane, Mary Jane, Mary. I know what it is. Okay, so now there's a video I would like to play for you very quickly. As you play the video, it's a very short video. It's literally 5 minutes. Then we're going to ask Minister to come up and address you and speak from her heart, a few things that she would like to share with you after having listened to everybody. As we find the video, okay, I'll mute it. As you find the video, what I would encourage you is if you have a question or two, do keep that question with you or write it down. After the session, we'll ask whoever you want to direct the question to engage with you outside of the program, so that we wrap up. So thank you very much. Minister, my job is almost done. I told them that if I cut off halfway, you'll have to top up the rest of the salary. I'm kidding. But anyway, let's play the video, and then Minister, immediately after the video, Minister will come up and speak to you very briefly. This is the Minister of Social Development. For those who don't know her, her name is Ms. Lindiwe Zulu. If I have to read her CV, it will probably take me another 20-30 minutes, if not slightly longer. But it is available online. You can reach it there. So thank you very much. Can you give a hand for the Minister? Don't be like that. So, Minister.
Thank you very much. I know that people have been sitting here for a while. I think I'm hearing myself. Maybe they can sort that out. Thank you. So, Vice Chancellor, thank you very much. Dia Reddy, University of Cape Town Division of Addiction, John Psychiatry, UCT Faculty of Health Sciences Dean, Professor Lionel Green Thompson, we met earlier on. Professor Goodman Sibego, thank you very much for your presentation earlier on. Education was also here. Higher Health CEO, we've met many a times. Thank you very much for the journey that has been traveled until now. And may I also just indicate that I like that slogan of each one reach 10. Yes, each one reach 10. I hope that it can, you know, like it used to be in the past when each one teach one. I also am very happy with your focus on civic education, because I think this is one of the things that is missing a lot in South Africa, and this is not something that should be learned just for passing exams. It is something that we must seriously take to heart and look at it as supporting each other as communities and society at large. The volunteers, thank you so much for being here. Power to you, because I think that volunteers are people who take it upon themselves without even getting much. They go out to the communities and they assist our communities to become better, and they assist our citizens to become better citizens. It's a lot of work. To volunteer, it's not an easy thing. I say to volunteer is not an easy thing because it's extra to what you normally do. It's passion that you have for doing something extra to give back to community one way or the other. So I'm hoping that you'll get more and more volunteers. And by the way, when we talk about volunteers, my view is that the issue of volunteering, we must begin to look at how do people exit from there to become better, to go and do something else. We started our own volunteer program in the department through National Development Agency, and my issue with that was that the people who are volunteering in many instances are community members who have absolutely nothing. Many a times the people who are volunteering are students sometimes who finish university, finish technicon, and they are not getting the jobs and they volunteer. And I said to the department, you must train volunteers so that you can have a plan for them to exit somewhere else. While we might praise you and do all that, we must also be sensitive to the fact that we are also people that need to live your lives and be able to contribute to your own environment, your own families, and so forth. I'm very happy to be here today, and I'm hoping that this is not going to be a once-off engagement. It is something that we will have to maybe next year again, when we have around this time, we'll be having our budget speech. We should be able to come back here and say within the year that we were here, or within the period that we were here, this is what we have done, because we have to be accountable. We are here also because tomorrow I'm presenting my budget of the entire department, both the DSD, SASA, and NDA. Those of you who'd like to join, you can watch, and I think communications will communicate how you can be able to join there, so that you can see where this taxpayers' money goes to in as far as the Department of Social Development is concerned. And of course, today is very important because we are about to write another historical chapter, which is about to turn around the lives of many South Africans, especially learners in institutions of higher learning. Listening to Correctional Services, I want to look at all of you young people here and say to you, in the best way that you can, make sure you don't land there. And it is possible for you to fall on the wayside, and when you fall on the wayside, you'll start blaming a lot of people around you. You'll only have yourself to blame. So you listen here, the statistics are not sounding very good. It is very unfortunate that our country, being a new democracy and all that, will be celebrating 30 years of our democracy, that in the forefront we are known to be number one of this, number one of that, number one of that, and unfortunately all the number ones, the twos and threes, are of negative things. Let us work towards reversing that so that we become number one in all positive things that are related to human development and human lives in particular. To the young people who are here, I want to say to you, you know, things are very possible to be on the positive. I'm sitting there and looking at some of you, and I'm saying, it is 37 years ago that I sat behind a desk like this. 37. I was a student. And when Sibego said, some of you would roll your eyes, I did roll my eyes too. More than 37 years ago. But the advantage that you have, you are rolling your eyes at home. I rolled my eyes in Russia. I rolled my eyes in a lecture place like this, with a professor and a lecturer walking up and down here speaking in no other language than Russian. And I had to make sure that I learn and I listen and I pass. I've got a master's degree in journalism. And that master's degree was not obtained at home, where at least I could maybe visit my aunt or visit my brother or my sister. There was nothing like that. For a whole 6.5 years I was there. I didn't know what was happening to my family. I didn't know what was happening to my children. I didn't know what was happening to anybody. So if you guys hang around here and complain and be bitter, you don't know. You just don't know. It is possible for you as both as the ones who came from school and the ones who are at university here. And I say, look at me and look at me carefully and look at me very seriously, because at the age of 16, I had my first child. When my grandparents were doing everything to take me to school, what did I do? I went the other way. As if that wasn't enough. At 19, I had the second one. And at some point that needed to break. And at some point that needed to stop. And at some point that needed to stop because I took the decision that it has to stop. I took the decision to say, why must my grandmother be crying and my grandfather be struggling like this, trying to get me to just be educated? Because my grandmother said to me, she was a domestic worker. She never wanted any of her children to be domestic workers. None of her children were domestic workers. And she said to me, you've got to be 10 times more than your father, who was never a domestic worker, your aunt who was never a domestic worker, because she dared be bold enough to take that stand and say she will educate her children. So when I disappointed her in that way, when she was struggling like this, going to Johannesburg to go and buy clothes and goods to come and sell in order to keep me in school, and all I did was the other way. And then she decided to say to me, pack your bags, go somewhere else, go stay somewhere. I don't know where you're gonna stay. I'm fed up, I'm tired of you, because I'm laboring for you to be somebody in your future. So when I say to you, look at me and look at me thoroughly, it is because I am a living example of when you have parents. I didn't have. I mean, my mother was there, my father was gone. I only had my grandparents, and I disappointed them. And I'm saying to you, if at any point you have disappointed your family, it is still possible for you to stand up and do better. And I'm being personal here because I'm talking to young people. Many a times we come and we speak and you see us walking in high heels and so forth, and you think we became like this just like that. It's not true. I went through that process of having the children, of not being in school. My savior was joining the liberation movement. My savior was joining the African National Congress, and I wasn't the only one. Others joined something else. My brother joined the PAC. We were to meet in Tanzania there, not knowing how did we get here, but we were there. My savior was the liberation movement, but my savior was also myself, because when I joined the liberation movement and I was given an opportunity, I held it with both my hands. When it was said, you want to go to school or you want to go to MK, the ANC at that point said to us, all of you who are below 20, stand one side. All of you who are above 20, maybe you'll go to Umkhonto wesizwe and go and do your military training and come back. As for you young ones, you must go to school, because this South Africa is going to need educated people. Isn't it true? That's exactly true. So it depended on me, because I then said to myself, my grandmother would be very angry with me if she had that I had an opportunity of going to school and I did not. I decided to go to school. And when that opportunity came for me to go to school, everybody wanted to go to London, to America, to whatever. The scholarships that were available in bulk was only those ones that of the socialist countries, and that included Russia. And I said, well, if the Americans can't give me the scholarship, if the British can't give me the scholarship, these ones are giving me the scholarship, let me go. Ngiyobona khona phambili. And then when we got there, they said to us, there's no English here, there's no French here, there's no nothing here. Everything shall be done. You see, 76, we were fighting against the medium of instruction, Africans. I got there and they said, you're not going to fight here. Here you are going to do all your subjects in the language called Russian. You shall write it, you shall read it, you shall speak it. Tak što ja govorim по-русски. So, all I want to say to you, you are in this room because you are among the ones who are chosen to be in this room. You are in this room because your parents dared to help you to be here today. You are in this room because whoever it was, whether it was your parents, a caregiver, or anybody, they sacrificed to get you to be here. And all I'm going to ask you today is to say to you, don't fall on the wayside. Don't spend your time doing what the other sister, where she was talking about the things that she does. And she's bold. She's bold because not many would do what she did. Not many would come and be honest here and say, yes, I do this, yes, I do that, yes, I do that. It was a sample, but somebody had to bite the bullet and be in front of us here and tell us and make us see what that tool is all about. So don't be embarrassed and be shy, because now at least when you'll be answering it on your own. You won't be having this crowd that is here. And so, in conclusion, I know the department is going to kill me for not going through the entire speech and all. But you know what? This speech can be read by people when they want to read it. This speech can be distributed and people can sit and look at it and be able to remember all the time that we are building safer student communities against crime, substance abuse, gender-based violence, and we are using this tool that is being launched today. And I wish to thank the department because they started this work some 5 years ago. And they've been very consistent in it. They've carried it throughout. They've been to universities. They've been to technicons. I do wish, department, that I can have the time to be going and speaking to these university students and tell them that when you look at me, don't see perfection that became perfect today. When you look at me, just imagine a 15-year-old getting pregnant, getting the first child at 16. Just look at me being Kosho Gogo. Ati, pack your bags, go out. I don't want to see you ever here. Fast forward. I have a master's degree. Fast forward. I am a minister of social development. And let me tell you something. Nobody did me a favor to put me where I am. Nobody. I can tell you I worked very hard because there were hundreds and hundreds. There are 1 million members of the ANC. Now imagine yourself in that 1 million. And this nonsense of people telling you, no, these ministers are there because they are done favors here and there. That's bullshit, quite frankly. It's nonsense. Oh, sorry for my language. If I was in parliament, the speaker would have said I must withdraw. I withdraw. Unconditionally, I withdraw. Unconditionally, I withdraw. It is just that I want to say to you guys, you have a choice. You choose to be on the negative side or you choose to be on the positive side. You choose to carry burdens with you forever or you choose to throw them away. You choose to go around picking up all these burdens and carrying them on yourselves, or you choose and you say, I ain't gonna carry those burdens. All I'm going to do is I'm going to be positive to myself. I'm going to be positive for my family. I'm going to be positive for my community. I'm going to be positive to the people even in the university. I'm going to be positive because I can see where the future is going. And if you think somebody's going to do that future for you, think about me again. I took the decisions to say that and no more. I'm not saying I've been perfect. I'm not saying I'm an angel. No, I'm not saying that. But consistently, I've told myself, I cannot continue disappointing my grandmother. I cannot continue being the opposite of what she wants me to be. I cannot continue to be a disappointment even to the people who work with me, around me. So whenever something starts, just remember me that, hey, I went there. And I pulled myself out of there. See the sister who was talking there, talking about the wanting to have the drink. Now I started drinking vodka, you see. my first drink was in the tub. Now you can imagine, vodka. That's the worst you can think of. But even then, as it was cold, as it was difficult, as we were writing exams on Christmas Day, their church that didn't work there. There was no church there. And they made sure we write the exams on Christmas Day because they know that we're going to be wanting to go to church. As we did all those things, we kept on thinking maybe the drinking is going to be fine. Maybe the smoking is going to help us. I decided I'm going to get out of that. So you must make the decision. Don't go blaming somebody else for your burdens and for your problems. You must tell yourself, I am not going to be a visitor at Correctional Services. Thank you very much.
Yeah, that. Thank you, Minister. No, listen. Two things. One, I'm glad she didn't use the speech. Otherwise, you would have walked away from here, Minister, saying, right? So she spoke from her heart, right? And I think that's important. Two, she highlighted the importance of not blaming others. We must not do that. And most importantly, I'm tempted to say, Honorable Member, that was not parliamentary. But I won't because we've cut that out the script. But thank you very much, Minister. Very powerful, very impactful, 100%. So I'm going to hand over to the Prof to close us off. Thank you.
Thank you very much. Molweni, Sanbonani, Nonke. I just want to make a couple of points of thanks. And the one I'm going to say is how grateful we are to be gathering with you in this space. And earlier when we were at lunch, I was speaking about the fact that this is an event of mutual enablement. It's come from the work of Goodman Sibeko and Dan Stein in the Department of Psychiatry, but it's enabled by government collaboration. And I think the relationship is one of mutual enablement, and that we're very grateful for. I really have to echo what the DG has said, Minister, and really commend that speech, which I think was just what we needed at this time of the afternoon. But there are a couple of themes that I think have emerged this afternoon, which I'm very grateful for. There is this idea that personal stories matter. And I think what the Minister showed us is that you can shift the script and tell a story that matters. And I think we must all be valued, recognize that as valuable, and this idea of standing up and being better. I want to just commend Naledi's comment for telling us that the perpetrators are amongst us. And it is the women who raise the men who cause the trouble. And it is the men who watch the men cause the trouble. And so when that skit was happening, you reminded me, I'm grateful for that, about how the nervous laughter in the room whenever the woman gave an answer that we recognized in our own stories, and it makes us uncomfortable. So when I looked at my result on my assist program this afternoon, I have to go back and reflect on the story it is telling me. Because there are a lot of things we take for granted in this area of substance abuse in our own communities. And then I do want to say thank you for the assist tool, because it gathers us today. And I've often spoken about the fact that we are gathering in a space where the very first people who gathered in this place called it Kamirodi Khais. In the language of those first people who lived in this part, it's called the place of the stars. And it is not the place of the stars for the people who live in it, but for the enlightenment that comes from this place. And today this assist tool has made me give thanks again for the power of the enlightenment of things like these. Because what the assist does, and it's a challenge to all of us, is constantly use that tool as a point of reflection for ourselves. But I think I'm going to say one last thanks, and again, it really is echoed by the minister's speech, to all of the people who've made the event possible. And I'm not going to do a whole line of people, and I hope the MC releases us straight after this, because we are now all late for our 5 o'clock appointments. But I just want to speak about this idea of the wisdom of a life experience, and how in the alienation of Russia, the minister has taught us about rediscovery of oneself. And for me, I'm really grateful for that lesson this afternoon, is that in all of the things that we've said and in all of the people who have spoken, this message comes through about how do we value our personal stories and recognize that we're all alienated at one point or the other, but we can choose. And in the question of substance abuse, the tool allows us to recognize that even if we think we're okay, there may be signs that we've got some work to do. Because in South Africa, unfortunately, our relationship with alcohol and drugs is not a good one. So I want to say thank you very much for an important afternoon. Thank you, DG, and thank you very much to everybody who's come to the campus and enjoyed this afternoon with us today. Shall I dismiss? Shall I dismiss?
Sorry, there is no better way to sum this afternoon up than the way in which the Prof has just pulled it all together. Of course, the personal stories do matter. If there's one lesson that you must take from here, is that you all do, and you all will have a personal story to tell. And so make sure that that personal story is a positive one. It's going to encourage somebody and not pull them down. So I think, in that light, this afternoon, we are done. And thank you for being part. Please make a promise to the person next to you. Say, I will do the Assist app. Thank you, we're done.
Thanks, man. Your social worker must do my thing. Get a full civic knowledge. In Tier 5 will give them.
100%. But Prof,
mental health, they will do.
Yeah,